So the National Virtual Health Team, in partnership with Empower, the National HSE Office and the Office of Nursing and Midwifery Services, welcomes you to the series of webinars for clinicians to help them better understand video-enabled care. Our aim is to create an ecosystem of learning with clinical specialties that will provide an opportunity for shared knowledge and experience, support in the implementation of new ways of working, and practical tips and tricks from teams who have implemented video-enabled care to groups that are thinking about implementing it as well. This webinar will be recorded, as we said, and we'll host it online in the eHealth Ireland website. Please can I ask you to make sure that your microphones are turned off and that your cameras are turned off as well. If you want to ask a question at the end of the session, so there's going to be a nice question and answer session there. If you look at your task box above here, we can see there's a speech bubble. We show conversation, and you can write your questions into that speech bubble. If you would like to ask a specific question to one of the presenters, if you just put their name first and then your question afterwards, we will then ask that to the presenting group here as well. There is also in the chat function, if you have a look at it, there's a little link for an evaluation. So just asking the people who are attending just to take a moment maybe at the end there to complete the evaluation form there, just so we can get some feedback about how you feel the presentation was, and so we can change our workflow and processes as well. The team today, so we're really excited. This is going to be really interesting. The Audiology team, they've done some fantastic work there, and really looking forward to hear their story. I have a statement here from Gary Norman, who's the national lead, and he sends his apologies that he wouldn't be able to make it today, as he was waiting for a baby to sleep, and I think the baby just went to sleep as the webinar was about to start. So he sends his apologies, but I'm just going to read his statement after this just for you now. So it goes as follows. Good afternoon and welcome to the HSE Community Audiology webinar on exploring different ways of working in video-enabled audiology. As a matter of etiquette to all, please ensure your mics are muted until the appropriate question time. COVID-19 has without doubt had an unprecedented impact on all of our lives at so many levels, and at a personal level and at work. Our activity levels have dropped, but our demand still remains high. Consequently, we have had to look at new ways of working in order to minimize patient travel and direct contact, but yet to still be able to provide the necessary services for our patients. These approaches are required to protect both patients and staff, minimizing the potential transmission of the virus. One of the largest groups we have due to the impact of aging on hearing are elderly, many of whom are an increased risk of impact of COVID-19. Thankfully, we are in the technical age of the interweb. There are a number of applications now available and being developed that will enable us to engage and communicate with our patients and provide both technical support and counselling remotely. Rogna, Patricia and Murray are going to outline their experiences to date, providing the necessary remote support for our patients and their family. That was a statement there from Gary Norman, the clinical lead there. Now, without further ado, I'd like to hand over now to the team. So Broga, oh God, I got the name wrong. Patricia and Mary and Patricia will now be presenting. And what I'm going to do now is share. I'm going to stop speaking and I'm going to share my slide and hand over to the professionals there as well. Thank you very much. So 1 second now, and I'm just going to share my screen. Brona, if you'd like to make a start there.
Yeah, sure. Hi, everyone, and welcome to the webinar. Thanks for taking time out of your lunchtime. Myself and Trisha and Mari will talk a little bit about what we've done so far. And I suppose what we did at the start is kind of in terms of setup. We had to decide what part of what we do can be done remotely and what part of what we do can't be done remotely, and how do we basically give our patients or our clients some form of care within the restrictions during the pandemic. So Trisha and Mary work up in Donegal and Sligo, and I know they have been using Attend Anywhere for a little bit longer than we have in Dublin. But in Dublin, when we started back our clinics in mid-July, our managers had told us that we need to try and keep as few people on site for as little time as possible. So we looked at everything we did, tried to break all the appointments down and said, you know, what part of this needs the patient to actually be there and what doesn't. Alex, if you want to move on to the next slide, we can talk about the setup. So in terms of what we did and how much we thought that we could use Attend Anywhere, we weren't necessarily sure, but thankfully everyone was willing to give it a try. There's a little bit involved in the setup of it. So obviously us as professionals need kind of internet access. We need PCs or HSE phones with internet on them. And we need to be able to have access to a webcam or a camera on either the phone or the computer, and microphones and headphones. So that took a little bit of time to get organized, and thankfully the funding was there for that. We then had to get set up on Attend Anywhere, which each kind of CHO has an Attend Anywhere lead, and they will set up your clinic in what they called an Attend Anywhere waiting room. So each location will have its own waiting room with its own, I suppose, web link address where the patients can go into. So it took, I suppose, a week or so for that to get set up from an IT point of view. In terms of what we did with Attend Anywhere and how we used it, we looked at each of our different appointment types and how we could do it. We did some of our hearing aid fittings remotely, and what had happened was when March hit and we had to cancel all of our appointments because we were all redeployed, we decided that we would, of all the patients who were waiting to come and see us for hearing aid fits, we would program their hearing aids and post them out to them so that even throughout the pandemic that they could have access to them. We weren't sure how well it would go, but actually patients found it very beneficial and they were happy with their hearing aids. And Attend Anywhere has helped us to give them a little bit extra, I suppose, support in that. We use Attend Anywhere for our 6-week reviews. We had been doing telephone reviews and we continue to do that, but with Attend Anywhere, we get to do a video call where we are able to, if the patient's having any problems putting the hearing aid into their ears, or if they're having any kind of user issues, that we can show them and talk them through how to overcome some of those. With our hearing aid reviews for pediatrics, we've been using it to touch base with parents to see how well the children are getting on. Are they really struggling? Do they need to come in and see us? And it's good for the child and the parent to be able to see us and us to be able to see them. And then in Dublin specifically, what we've done is a pre-appointment session for new patients, whereby we try and do some of the, I suppose, the catch up and bits that we don't need the patient to be right next to us for. We will do that via a video session, and then when they actually come into the clinic, they don't have to be in for as long, and we can get, really concentrate on the hands-on kind of otoscopy and hearing test and all of that. But if we move on, we'll talk about each of them separately. You can go to the next slide, Alex.
Hi, Trisha here. I hope there's no, is there an echo on this? It sounds very echoey here. So from the pediatric point of view, when the lockdown came in, we kind of thought first, well, we'd be able to see our patients, as Brona pointed out, but really, what can we get done in the meantime while we're waiting to see them? Obviously, people are doing remakes of ear molds, and that's very helpful, and as everybody knows, that's worked really well. But actually, functional benefit is something that I think no more than speech validation that we all aim to do in our pediatric reviews. but actually give us a great opportunity to start looking at functional benefit. So how we did it was, we'll go through later on how we post out the notification to parents for the video consultation, but we'd also post out a copy of Peach or Little Ears. So they have a hard copy. So it gives them time, maybe, you know, whatever the week in advance. And as Brona says, you can do a pre-consultation phone call just to explain what it is that you're sending out, and parents get the time to observe. So we do this in the clinic. We're doing it cold, and parents actually don't have the time to think about some of the questions that come up on Peach and Little Ears, unless you're organised enough to actually send it out to them in advance. So this actually does give you that time. And what I do is, the parent has it, you're on the video call, you have AB opened, and on AB, if you go down into client information, you've got the list of questionnaires, you've got the custom questionnaires, you've got Peach and Little Ears, and you can actually score it on AB as you're talking them through the questions. And it's a great point of conversation for parents of young children. Little Ears, obviously, for the very young children, maybe under 2, that's a rough guide. And Peach is good up to about 4, 5 onwards. It's beginning to reach, and there's not great after that, quite frankly. I know there's some of the older ones, but they're not a great point of conversation. I don't find there's 2 up there that obviously I'm not sure, Brona, I meant to ask you, but there's one called a pediatric follow-up questionnaire, and there's one called a routine PCHI review questionnaire, and they're good. They've got nice questions for start, you know, to follow through. So if you find that Peach or Little Ears don't work, there's other material there to work with. So that's what we've been doing. A big area that we kind of, towards the summer before the visiting teacher service, we're on holidays. We tried a few times to, you know, make sure visiting teachers will contact the paediatric audiologists and say, well, what about, and what about, and what about? So it's like a 3-way conversation that we were having. They were talking to parents, we were talking to parents, and we thought, this is ridiculous, really. And the best thing about Attend Anywhere is that it will let up to 6 people on. So you could have a multidisciplinary review on Attend Anywhere. You do the invitation, so you send the link out to both the parents and the visiting teacher and the speech and language therapist and anybody else who's involved in the care of that child. And the way it worked for us, the way it worked best for us, is that very often the paediatric audiology review, it might happen, say, 11:30, and 11:40, 11:50, the visiting teacher may have joined in because there's bits that we want to discuss generally. So if there was issues to do with assistive devices or preschool applications or whatever it was, it's a great opportunity actually to get that conversation that we don't normally get. So there's another little bonus that comes out of Attend Anywhere. 2 things so far. So normally we don't get to do all the functional benefit we'd like, and we don't get to talk probably enough to visiting teachers, and it's a great way for parents to be involved in that conversation. A great way, basically, of checking that the hearing aids molds are being inserted correctly, that if parents are having difficulties with their ear molds, getting them in, you know, we can talk that through, we can reorder, we can have them in face-to-face to retake an ear mold. The other thing would be, I found mainly we had a lot of children with trisomy 21, and they're children who very often have bone conduction soft band-aids, and they are an issue for all parents to get the actual fitting correct. So, you know, you can see and you can advise. So that kind of immediate follow-up for children is great visually, and you don't have to invite perhaps those children in to a clinic who, you know, obviously the risk factors would be higher for those children as well. So when you're doing the appointment too, it gives you a great opportunity to think, well, look, this is my list of children that were due for review this month. Attend Anywhere may fulfill most of what we wanted to do, or you will know basically if you have to have face-to-face, whether it's for an ear mold or the child needs to be retested, or you need to update their hearing aids, whatever. And the hearing aids can be posted in and updated, obviously as well, obviously if you don't have to retest. So that's generally what we did for paediatric hearing aid reviews. Okay. Do you want to go to the next slide, anybody?
Hi, everybody. Mary here. So just, I suppose, to talk a little bit from the adult perspective in terms of how AA has assisted us here in Donegal. And I suppose as of late of the news last night, everybody's aware the border counties have gone to level 4. So no doubt we'll be using AA much more than what we have been. So initially, anybody that would have been due to have their hearing aid fitted and were scheduled in for a face-to-face appointment, obviously they were all cancelled with the COVID. And so we contacted family members so that you'll see the symbols up on ABP, the program one with the little phone, and then the F one with the phone. So basically what we do is contact family members or the patient themselves or client and ask, do they have access to internet or smart device, and basically explain to them what would be involved in doing an AA appointment if they were willing to have their appointment done that way. And to be honest, from my experience, the majority of clients were very pleased rather than sitting waiting another additional couple of months to get their hearing aid. So at that point, when we would program up their hearing aids, we would send them by registered post to the client or the family member who would be assisting them. And along with their hearing aids, and generally we would do this with especially all new clients, all the information would be sent out, relevant leaflets including information on chime and repair service. We're fortunate here in Donegal, we have an MTA here with us, so we have a fairly robust repair service, which is great. So we also would have sent out an appointment letter, but just a little bit different to what it would be in terms of coming into the clinic. It included your URL, the date and time. I don't know if any of you have looked up AB, you'll see the prototype 1 letter available, which can be customized to your own area. The video link, information on Attend Anywhere itself, and also when we would link in with the patient over AA, we would go through their consultation with them as if they were here. In particular for an open fit, you know, we were able to click and fit and post out the hearing aids, and then if it was a BTE, we could obviously do a simulated REM. But we were able to physically see the client from the comfort of their own home and perform the fitting visually with them or with their family member. If we needed to make any adjustments, if you're familiar with the Signia portal, we were also, family were able to download the app. Anybody that had the smart device was keen to maybe have the app as well. And we were able to do our counselling and rehabilitation. The only thing was missing was the client next to you really in the clinic. You know, everything was, you know, you're just missing that slight personal touch that they would be in with you. But other than that, everything was pretty smooth and it was easy to adapt to. And I suppose going forward from now on, because we are still seeing clients, once they've had their direct referral assessment, the first thing we're offering, obviously for safety of client and staff here, is would you like to avail of your appointment via AA, or would they prefer to come in? So it's lovely to have that extra or something different that you can offer them the appointment virtually rather than coming back in if they're a bit anxious about attending. So I suppose we could go to the next slide. So following our fitting appointment with the client via AA, we would ask them then, would they like to avail of their 6-week review either by telephone, or if they were able to use their smart device themselves or needed a family member, we could again do it via AA as well. So we would complete the COSI at that second part of their appointment post-fitting. And again, if they were having any difficulty struggling in terms of maybe the hearing aid not correctly inserted, Margaret would be able to do that with the client over AA. Again, they might need just a little bit more extra counselling or re-instruction. Again, batteries, volume, the usual things that you would do at a follow-up 6-week review, whether it's virtually or on the phone or the client was in with you. And then you will have those handful of clients that just need to come back in and are happy to attend in person. And so that will be brought to our attention, and then we would offer them an in-clinic appointment. So yeah, overall positive. So the next slide there for Brona, I think it is.
Oh, sorry. Thanks, Mari. So yeah, the next bit of how we use it, and particularly in Dublin, we would have created what we call a pre-appointment session on Attend Anywhere, whereby when it comes time for us to be able to offer the patient an appointment, we would contact them and explain the situation, and explain, I suppose, the restrictions that we have due to the pandemic, and explain to them that our appointments have slightly changed, that rather than just coming up and getting everything done while they were with us, that we would contact them via Attend Anywhere, and do some of the history taking and the talking bit at the start of the appointment, so that we could streamline things when they actually came on site and they didn't have to be in a healthcare facility for any longer than what they needed to be. So the purpose of the pre-appointment session is basically to discuss with the client the referral and the reason for the appointment and their expectations of the appointment, and to record their client history. If it's for our pediatric clinics, we also are kind of developing or assessing the development of the child. We're trying to see what testing approach would be applicable when the child attends, and then triaging the clinical appointment depending on maybe parents' information that we've got that maybe wasn't on the referral letter, and the needs of that particular child. The benefit of Attend Anywhere for this is that the child can be there for some of it, but not all of it. So when they come up into the appointment, usually in the face-to-face, sometimes, you know, the child's busy and they want the toys or the parents' attention, and there can be distractions to getting a good client history. So with this, we have told the parent that it's beneficial if the child is there for some of the appointment, but not all of it. So we get to speak one-on-one to the parent, and then also you know, see the child. The child gets to see us without any masks on, and we're seeing whether we need to do VRA or whether it's a play audiometry. So it cuts down a lot of time in the appointment, in the face-to-face appointment, and all of our history and that can be recorded directly into AuditBase so that it's there. From our adult clinic point of view, we will carry out the history and start the COSI. So that's all done, and whenever they come in to the appointment, we're going straight ahead with otoscopy and hearing test. We will explain to the client what's going to happen when they attend at the appointment or the clinic, so that they know what to expect. Things are going to be different when they're walking into a healthcare facility now. There's a lot of signs for social distancing and people wearing masks and that. So it's our chance to explain that to them so that they know exactly where to go, when to go, and we have a lot of the background information already gotten before they set foot on site. And yeah, we find that works quite well. If you want to move on to the next slide, Alex.
Okay, for the pediatric clinics, we did find that parents were very happy. We were lucky in the respect that we have an Empower team working in North Donegal, liaising cross-border into Scotland for a EU-funded project. So they did, you know, it wasn't a large, but it was a small feedback survey, and parents were, you know, obviously they're young, they have no problems, you know, using the smartphone, clicking on and making sure they have the link right. That was no problem to them at all. Parents were generally happy that they didn't actually have, you know, if you have children, particularly when everything was locked down, parents were sometimes having, you know, 2 or 3 children in their care, and obviously it's great if you don't have to have arranged childcare, and elderly grandparents weren't able to come in and mind other children. That was something that parents have brought up. I think one of the biggest things I would find with it would be triaging. It gives you that opportunity. We're all faced with large review lists, and if you can look at your review list, if you can organise your reviews, whether they be a pre-appointment review or an actual review for a hearing aid child, it gets you much more quickly to realise what your priorities are. So you can organise your caseload much better. You know, you'll be thinking basically of that list today. You know, there's 3. I actually have to bring them in face to face if that's open to you at that moment in time, or that I need to be in contact with the visiting teacher service about whatever issues are at school. Also, parents will come up with information that, you know, we're not aware of because it's been some time since they were previously seen or referred. Indeed, with a pre-appointment contact, you would be able to find out pretty quickly that actually this child may no longer need our service, may actually be a child who's already received a service elsewhere, or parents are no longer worried and are going to put it off to a later date. So, and from that point of view, from triaging point of view, it's it does tend, it will slow us down a little bit, but I think maybe reduce the need for intervention in all children. So finally, that without a face mask seeing you, I think we, particularly with children who have hearing impairment, they're coming into clinic now. I know we're wearing visors and staying the distance when we want to address children, and they're great. They're always, you know, coming in with their face masks on and they love it, but they are struggling, and they're struggling at school. So this is one more place where they will struggle when they come in. And obviously, you know, you're in and you're out of the clinic if you have the option of being in another room to test from. But what you will find is that children will be struggling. So actually doing it on AA gives children and families that option. Seeing your face of a child maybe opting themselves to wear headphones. We've had quite a few hearing impaired children who just love the whole thing. Love the fact that they could have a direct conversation with you. Obviously, we're in the mild moderate hearing impairment category, had their headphones already and waiting, and had great conversations, were able to tell you how they were managing with their hearing aids, and then you get to talk to the parents in the background afterwards. So families who have children with hearing impairment are well able to work out what the technology will do for them, and I think seeing them on AA gives you that opportunity to do that. Mari, do you want to finish with the adult clinics?
Yeah, so obviously I deal mostly with the older clients, and so safety is paramount, obviously under the current pandemic. Donegal geographically is a massive county, so there's a plus there in terms of not having to travel, and especially if family are maybe working or still currently working and they don't have to leave their work to take mum or dad to the appointment. So there's a plus on that as well. Reduced waiting times, obviously, for open fits can be done much quicker than what they would if they're coming back into the clinic. And if you are like the rest of us, most of our ENT have a large waiting list as well. So anybody who has a current up-to-date audiogram, you can take their fitting from that. And so there's a lot of pluses in that way as well. In Donegal here, we do some outreach clinics. So obviously they have been minimised as well during the height of the pandemic. So it means that people aren't having to go that extra distance to travel, and they're able to avail of it that way. So there's a lot of pluses to it, more so than negatives, I have to say, personally. Yeah. So go to the next slide.
Yeah, sorry, I'll take that one. You know, it's a very good system, but it's not perfect, and there are some drawbacks to it. And you know, some parents do prefer the face-to-face approach, and especially if it's something that they have been used to on a regular basis, and they are maybe feeling that their child is missing out in some way. But I suppose that's up to us as audiologists to you know, if we're happy that the child has everything that they need, that we're able to get that across to the parents. But yeah, some parents did feel, oh, that this didn't have exactly what I usually have in terms of, you know, the testing and the treatment, and they would query that a little bit. But I mean, I have to say, everyone seems open to change now in these strange times, so it's a bit easier introducing something that can be very different and very new. Sometimes parents don't always remember the appointment or the time of the appointment. So again, kind of reminders and making sure that the appointment letter is very important. So they have, I suppose, physical remembrance and evidence of that. Per internet connection is actually a big thing. Even in Dublin, where people would expect internet to be good, not everyone has very good Wi-Fi speeds, or not everyone has the, you know, technology and that. So it definitely is a barrier, and some difficulty for some hearing for parents with hearing loss. So some people with hearing loss don't necessarily like using phones or using kind of like a video conferencing thing, and prefer to be in person or face to face. With our adult patients, they are more reluctant to use technology. They're not used to it, although we're seeing more and more that they're getting used to it in terms that they are, you know, learning how to use technology to communicate with their family members and stuff. So we're thankfully benefiting on the back of that. We find that for pediatric clinics and also adult clinics, that some audiologists are a little bit reluctant to use technology and to do things in a newer way, or they maybe feel I don't know, like a little bit exposed on a video call, or it's also a very different way from how we've always done things. So it does require, I suppose, a bit of a shift in our thinking. And you know, sometimes some people have reported reduced quality of interaction, and so the sound quality isn't always the best, and that can obviously have an impact for our clients who have a hearing loss anyway. Do the next slide.
Sorry, Brona, to interrupt. It's Lorraine here from the National Virtual Health Team. We just have a query there from Emma, just asking, could you turn on your camera, please, so that she could lip read, if that's okay?
Sure. Sorry, I didn't realize it had gone off.
Not at all. Yep.
Sorry about that. Sorry, I don't know how that happened. Sorry, Emma. Will I go through that one again, or are we okay?
I think if you continue from there, that should be fine. Thank you, Brona.
Okay. I think the next one, Mary, are you going to do the enablers?
Do you want me to start here with the, I'll start with pediatric.
Yeah, please.
Yeah. Oh, have we gone ahead with the next? Have we gone? No, we haven't, sorry. Actually, we're repeating ourselves maybe a little bit about this, but definitely the third point, we found that by texting clients that the URL link really helped them. So, you know, we're sending stuff out, we're going to go through that at the very end, the very practical stuff of what we send out, but it's a typed URL. So who can use a typed URL? I would make a mistake every time. So it's very useful in that pre-appointment telephone call or COVID that you say to people, actually, you'll get a link in the paperwork that we send out to you, but perhaps it might be easier if you're planning to use your smartphone, if we could just email or text it to you. They can email it on to themselves if they're using a laptop or whatever, but it just makes life that much easier. And we just found that by, you know, obviously parents were coming back and saying a little bit delayed because we had thought, oh my goodness, we've sent them, you know, how many characters are in the URL and somebody's going to have to look at it and get it correct. So that helps a lot. We're not at the stage we keep email addresses for people. So from that point of view, we just text it out. It's good in a way that when you're having these pediatric clinics online with a video, you're getting that time to explain why you might want to see the child, or indeed why you don't think it's really necessary to see the child face to face for another while. So you get to explain the reason why you're calling them in, and the reason maybe that you're going to defer for another how many weeks or whatever. So sorry, I'll hand it over now to Mary. Mary, you might not have your mic up. Yeah, your mic's off, Mary.
Do you hear me there now? Sorry, that keeps going off. You can hear me there, yeah?
Yes, perfect.
Okay,
Thanks, Mary.
sorry. So yeah, again, just about the link, I'd be the very person to put an extra digit or character in there. So I suppose when you have family members present for the hearing aid fitting, they can assist and ask questions on behalf of the older person or the elder person that we may be seeing. Important as well from our administration staff perspective, it's great when somebody calls in and we can offer them that they can explain to them how easy it is to avail of the Attend Anywhere. Everybody's very au fait with it here with ourselves and very easily to people, and it comes across in a friendly kind of easy understand way. So I think people are happy more or less to avail of it as much as possible. So yeah, and it's great that we can send the text via the phone as well, so they have the link rather than typing it in, which is important. So some of that, I suppose, already has been covered with the pediatrics as well. Yeah, to go to the next slide. Yeah. You, Brona.
I'll do these ones. So, I mean, the barriers are actually very similar to 2 slides ago when we talked about some of the negative kind of outcomes or negative feedback, but people prefer face-to-face sometimes. Internet connection or no internet is a big barrier for lots of people in both adults and pediatrics. With the adults, for I suppose more elderly patients where there isn't necessarily a family member there or a neighbour who's there and that are able to assist them during the appointment to help work with the technology. They may not have smartphone or a laptop or a computer or internet access, and if they do, it may not be a good enough speed. So there's some of the barriers. Next slide.
Yeah.
I'm off again. Feedback generally from staff, as Mary just said, it's been largely positive. I think people recognise the limitations. It's not going to solve all our problems during COVID, not by a long shot. But it's a way of, particularly from the adult point of view, it's a way of maybe hearing aid fittings and 6-week reviews not getting postponed. And really giving people that encouragement to try their hearing aids. I think actually, having somebody, virtually come into your sitting room to review your progress with your child or as an adult, from what I found about it, I was quite amazed at how different their listening environment might be. Some children were in wonderful listening environments, and some children were battling in a kitchen with maybe 3 or 4 siblings running around the floor, and it makes you remember that that's what listening is like for a lot of kids. I do think the barriers for clients who have hearing loss that is severe, profound. We can't overemphasize enough that, particularly if you're elderly and your vision might be failing as well, face-to-face with face masks and even visors. Visors are going to be distracting. So if there's any way that you can set up video consultations with that cohort of staff, I think just like that first line of feedback there, great for communicating, because they can face read and you can use the type in, and that's wonderful. Pops up on their screen, so it's wondrous that we haven't been doing it up to now, and maybe this is where we will turn the corner, and this level or this type of intervention or tool will just become embedded in our service rather than thinking of it as an alternative to face-to-face. Because it works better for some people probably than face-to-face. They'll probably come around and start, asking, could we do it that way again? If you're not offering, that's the other thing. I just see that second point, and I wondered about that because that had happened with us once or twice, where obviously during the major lockdown in March to June, where you had families who they had other languages other than English and needed interpreter, plus an ISL interpreter. I see on that one. If you can get it 3-way, that's perfect. And I know the interpreter, the service that we have for non-English interpreter are very willing to come on to Attend Anywhere. So, we can still have those consultations with either languages other than English, and obviously the ISL interpreter, just like the visiting teacher, would have the link and could join the conversation, obviously, or sorry, join the interpretation. Okay. A lot of families are just nervous, don't want to come in, and great way of resolving issues. And as Mary said, you know, it doesn't matter how small it is. If it's a minor repair and you have, you know, a repair clinic going on, this is another way of factoring into your repair clinic. So you'll have drop-in repairs coming in and post and everything else. And then you may actually have minor repairs for people on a video call on the same day to look at it that way. The 6-week reviews, perfect, because you can see it. And actually the clinicians, I haven't done it yet, but clinicians here were suggesting, you know, rather than have a see-through mold, that you get a coloured mold. And the coloured mold will show up better on the screen. So you can try, you can show basically with a yellow or a blue mold or whatever colour you choose. It's just that wee bit more visible than some of the transparent molds that we're used to using. And I think, Mary, do you want to finish on the Signia app, because I haven't used that?
Yeah, and the Signia app, I have used it a few times with some clients where somebody would have downloaded the app and you're able to remotely adjust or fine-tune the hearing aid if needed. I mean, I suppose for the moment, for most clinicians that are performing the AA, if it's an open fit, we're just clicking and fitting, and if it's a mold, we can do an SREM. But we can adjust the actual hearing aid settings if required by the client via the app portal, and it was actually very easy to use. I was a bit apprehensive about it myself, but yeah, easy to use, and you can get instruction with Ian if needed. You get your login to log into it. Once you log in once, you're there to use it again. You don't need a password every time. So just if you are struggling with somebody at the 6-week review that maybe needs a bit more fine tuning, you can use it that way. So it's good.
Yeah. Mary, can I just add on the Signia app and portal?
Yeah,
we've used it a bit, and we do find it very good for some clients. There is a bit of the setup. So when you're setting the patient up with their hearing aids at the start, they need to be set up with it's like a portal code rather than just the QR code for the app. So if you've set them up the old way without access to the portal, you always have to uninstall the app and reinstall the app to be able to get access to make the adjustments. So just so that people are aware of that.
Yes, so you have to add them in. So anybody that you've pre-programmed up, they will be added into your I suppose it's like your wee system there for the Signia app.
Yeah.
So they will be there in that.
And then the patient gets a code then to put into their app so that it works. Yeah.
Yeah. And I suppose just as well to add as well, when sending out hearing aids, whatever your postal service is like in whatever part of the country you're in, we would always allow, we've kind of said a week to 10 days just to ensure that the clients have their hearing aids before you go for your AA appointment with them. Because remember, you've given them a date for their appointment. And I find generally, and I know Elizabeth, my colleague here, would say the same, that people are actually wearing them by the time you get to them, which is great. So half the work's done, they're ahead of you, which is brilliant. So it gives them the kind of the push nearly to start and have a look at them, decipher between right and left and have the hearing aids in and get familiar with them. So it's good.
Yeah, just to add to you on that, maybe it was said earlier, but we do register post out the hearing aids and molds because we just need to have some track and trace on them if things go awry.
Yeah, because we're not signing, I suppose, for them.
Yeah,
absolutely. Yeah.
Well, we move on to the next one. I'm aware that people are on their lunch hour and that people want probably to ask questions rather than us continuing.
Yeah. So that's just the appointment letter. Attend to anywhere virtual health video appointment. So that's what it looks like. If you can see that, okay, it'll install the date and time automatically from the system and the client's name, address, and then you would have all your other relevant information with it. The leaflet, the virtual health attend anywhere leaflet comes with that, and then your hearing aids and everything's registered with that.
We want to go to the next one.
That's just another version of this. There are two different versions of the appointment letter that's accessible for everyone. Yeah. Go to the next slide.
Yeah.
That's what Mary just mentioned. That's the Attend Anywhere leaflet that you can just roll them off literally off the site. So there's a right hand scroll down, and it'll give you able to copy the URL, or you can, you can then send it out by text or whatever, and then you can also print these off and basically have them in your admin office to go out with the appointment letter.
You can move on to the next one. The next one's a practical, but Alex, I wonder if we just send everyone maybe the link, and if we give people time to ask questions now. I'm not sure, Tricia and Mari, what would you think?
I think that's a great idea, because I think there should be some good questions there as well. So I might, I'm going to stop sharing there, and I'll put the link to the channel into the chat there, and I might ask Lorraine if she'd be kind enough to do some of the questions there.
Yeah, perfect. Thank you, Alex. So if anybody has any questions that they'd like to ask of the panel, if you would like to add it using the speech bubble at the top of your screen there, it's the middle one between the hand and the two people. So if you click on that, it'll allow you to type a message. Alternatively, if you want to select the hand, that just shows us that you've raised your hand, and we can come to you, and then you can unmute and ask your question in person if you prefer. So we have our first question there from Emma Macaulay, and is it possible to get a copy of this presentation, please? Yes, so I'll answer that one if that's okay. So we will be publishing both the presentation and a video of the webinar on the eHealth website, where you would have gone to click on the link to join us today. So if you just keep an eye on that over the next few days, or it may take up to a week, just because we're doing them kind of 1 week at a time, you will see it there. Thanks, Emma. And Alex just added the link there. Is that to the presentation, Alex?
Sorry, that's the link to the video. So that shows the Attend Anywhere program itself to watch for in your own time. So it's a really informative link there, just to show how it works in real time.
Perfect. So we have a question in there from Maria. How safe is Attend Anywhere from a data protection point of view? Alex, I might like you answer that one, if that's okay.
That's it. Thank you very much. Yeah, so the Attend Anywhere program has been approved by the HSE, and it has gone through all the data processing agreements. So it's secure and it's encrypted end to end, and no data is really stored, or patient data is stored on the platform itself. So it's been approved by the OCIO and the HSE for use clinically, and it's perfectly safe to use with patients there. Thank you very much.
And just to add on that the Department of Education Visiting Teacher Service have also agreed that they have removed any barriers on their the visiting teachers' their laptops, so they can access through laptop or smartphone.
Okay, we have a question there from Julie. Do you think e-hubs where patients could access the technology close to their homes would be useful for those who don't have access to devices? I think that's to the full panel. I don't know if anyone wants to.
Yeah, I don't mind. Yeah, I can imagine libraries, etc. Basically, or e-hubs. I think libraries are where a lot of people in rural areas tend to go to access, but I'm not sure whether or not, full consultation in that situation would be. I don't know, actually, straight off. In terms of privacy, it might be difficult. I'm not so sure about e-hubs, Julie. I wouldn't know.
I'm not sure. Also, I know a lot of libraries and stuff like that closed again as the restrictions are increasing. So it may not be a viable option, but actually not a bad idea. I think if we can ensure the privacy, it'd be good to be able to give access to patients who don't necessarily have the technology at home.
Great, thank you. Just a note there from Wendy Rutherford, who would have worked with you. Patricia and Marie were very early adapters of Attend Anywhere, inspirational service provision and commitment to their clients. We referenced their service in the national virtual training sessions on Attend Anywhere as a great example of using Attend Anywhere. So kudos to the panel there.
Thanks.
You've been mentioned, your ears must be burning over the months because we've mentioned you on several occasions also. It is really inspirational stuff.
Yeah, it really is.
Well done.
Thank you.
So the question there from Alex, what would you say to clinicians who say video-enabled care takes too much time? Is it, Alex?
Yep, time.
I'll open that to the floor.
You
Um,
mean
do you want to go ahead? Sure.
To get up and running, I suppose.
In terms of time, I can refer to Mari in terms of adults, but I would actually say for us, probably less time. The setup's probably the biggest amount of time. And if you have admin, good support, any support is probably good support these days. Any support at all, just basically to make sure that people are, aware of it, so that your client population sort of know that this is available to them, and that you printed off the information, and that you have a webcam. Webcams seem to be the hardest thing to get. I borrowed mine for today, believe it or not. But old laptops, if you have an old laptop, it won't work for Microsoft Teams, mine, but it works perfectly for Attend Anywhere. The great thing about Attend Anywhere is that it doesn't matter how old your technology is. If you've got a camera, it'll fly. You just paste it in, and it'll, so it's great for people who maybe have, I can tell my mother has an ancient laptop which she never uses, but if it came to it, it would be the one that you could open and know that Attend Anywhere would be useful on it. Yeah, so if people have old technology, it works with Attend Anywhere, which is a great thing. Not so Microsoft Teams, as we found out.
I would agree too, Trish. I think that it doesn't necessarily take too much time. I think the extra time is more maybe us as staff getting used to the setup and feeling awkward. I actually find that like parents and clients, they don't sit on and chat on a video call.
That's right.
As long as what they might do in an appointment room. So
I suppose the other thing is we don't have many alternatives really at the moment. That's what we kind of have to keep in mind.
Exactly. And so you're still giving a level of care to patients and clients, this way rather than nothing, for us here anyway, at the moment.
I thought it was a very interesting comment that you mentioned there, that possibly some people actually prefer it, and that even when all of this gets, back to our new normal, that maybe they'll actually look for it to continue, and that's really positive to hear. So
yeah, and I definitely think that we kind of have that mindset that it's COVID related, we might not make the use of it. Whereas if you kind of try and think about embedding it in the service more, that you're thinking 6-week reviews, why, for most of them, for pediatric, a lot of it could be done through Attend Anywhere.
Definitely.
So I think we just try to maybe not think of it as a tool just for COVID. And that's something that can be adapted for
the
general.
Positive out of it.
One final question there, ladies, if that's okay. Do you find it beneficial seeing the domestic environment when you're on the call?
Roman?
I think it's good to, I suppose, know exactly from a pediatric point of view, as you said, Tricia, like what sound environment they're in, whether it's a really busy house or whether it's not. Children actually can sometimes be a lot more relaxed in their own home environment. I don't know about you, Tricia, but I find that every child that comes into, especially the younger ones, they barely speak from they come in until they go out. They just seem to find it a little bit overwhelming, but they seem to chat away on the video call. So you get to assess, I find their speech development a little bit better than what you would when they're in the clinic, and they're a little bit shy, whereas they're not as much that when they're on the Attend Anywhere call.
Great. Thank you very much, ladies. I just noticed it's just coming up to 2 o'clock there, so I think we might wrap it up there. So I'll hand it back to Alex, if that's okay.
That's great.
Thank you.
And so I'd like to just reach out and say thank you very much. That's been a fantastic and really insightful presentation and discussion there. And thank you very much for taking the time. And it's great, the work that you've done to I suppose, embed and develop and use the platform. It's great to see, and hopefully people will see and look back at this webinar and your presentation notes, and it will inspire them hopefully to adopt it into their own practice as well. So just from the Virtual Health team, thank you very much for taking the time to present. It's really appreciated, and that was a really brilliant presentation. Thank you.
Thank you, everyone.
Thanks, Alex.
Thanks everyone.
Thanks, everybody.
Thank you.